let me just backtrack a little and just to say how I decided on Wagner. So I actually grew up in New York City. I've always been interested in healthcare ever since in undergrad. And so after I graduated, decided to work for 2 to 3 years. And then as I was looking at graduate schools, I wanted to look for programs where they were flexible. I knew that going into grad school, I wanted to be work full-time, so I needed that flexibility. And second, I was looking for a program that had a very strong track record. And after looking at all the schools, in this area, in the city, I realized, Wagner is the one where they offer those two very important things to me. And number 3 was for all the schools that I looked at, I actually participated in their classroom discussions. I actually went to a school where the last year students were actually giving like a sort of like a capstone-ish type of presentation, and then I actually sat in at a Wagner course. And so I felt that out of all the schools I looked at, Wagner had the strongest type of interest that I felt for. But more importantly, even though NYU is such a huge organization, it's such a huge school, 44,000 students, the moment you walk into the Puck building, there is that sense of close community, that sense of like, if you need help, we are here and we can actually connect you with folks who have more experience, more expertise. So given those 3 different factors, that's when I said, okay, Wagner is the school for me. And then since then, I've always been working full-time and going to school part-time. It is possible, it is manageable. And in addition to doing that, I've also been involved in the school in a different aspect. So Christian's very involved in the school clubs and activities and whatnot. I'm more involved in terms of the open house discussions where, if you want to go to a breakout session about health, I'll probably be there. I participated in the 100 Cups of Coffee program where I talk to prospective students about what's it like being at Wagner? What is your career trajectory? Who should I talk to about other things? And I've also been a peer advisor for fall in 2011. So I worked with about 10 incoming students to say, this is Wagner. Don't worry, we're here to help with you. And I think along the way, being in healthcare, health is one of the very strong programs here. It's interesting because we're at a very interesting time in healthcare right now. Supreme Court case, will we still have health insurance before or after? And I think everything that I'm learning, I actually work at the New York State Health Foundation where I actually work in the cost and coverage area. So you work to increase health insurance, people enrolled in health insurance in New York State, reduce healthcare costs, and we actually work with state policymakers to implement certain coverage provisions within the Affordable Care Act. And so when you talk about, in our classes, current issues in healthcare policy, health economics, intro to health policy and management, all these issues, how do we improve care? How do we increase enrollment? How do we increase access to care? All these things are related to what I'm doing at work. And so when we talk about, okay, how do we better coordinate care for chronically ill patients? How do we, look at benchmarks or indicators of improved quality? I bring to the class things that's happening at the state level. So for example, we're talking about care coordination, patient-centered medical homes, and hey, guess what? New York State actually, or New York City is actually one of the communities that have the highest numbers of NCQA, PCMH, recognized areas in the country. And so when you think about what's happening from your books, from your readings, and I apply my knowledge to the class discussions, it makes that so much richer. And amongst you, there are students who are also working full-time. There are students who actually are going to school full-time, but may have quit their jobs previously, and they may have worked for a number of years. So I rely on their experiences, their expertise when we talk in class about healthcare issues. And so I think that's what makes my Wagner experience thus far been here for about, I think, 5 semesters. We'll graduate in about 8 semesters. I'm still enjoying every class, every moment here.